Thank you. I'm Mohamed Salema. I'm Associate Professor and Associate Director of the Institute of Global Health and Human Ecology. As I described last time, we were thinking of starting a longitudinal aging study in Egypt, same pattern and style as HRS. We teamed up with SHARE. SHARE is an aging study of the European Union, and we dedicated last 2 years for capacity building. And for that, we recruited funding from the German Academic Exchange Services. The money allocated for the capacity building, around 100,000 euros per year, was dedicated to raising capacities and start raising awareness about the value of aging study of the survey itself. We conducted the translation and cultural adaptation and validation of the questionnaire in order to be ready for its administration. The research team was from different places across Egypt. We were collaborating with 5 universities across different cities in Egypt, and we already administered the questionnaire through a pilot. The project itself is a capacity building program called EMATCH. It was aging in the East Mediterranean region, because it's in principle a collaboration between Egypt, the coordinator, and Lebanon and Jordan, and other Mediterranean countries like Cyprus and Greece, because they are members of SHARE, in addition to Germany, of course, the coordinator of SHARE study. As I mentioned, we started working on SHARE survey to be adaptable to the Egyptian culture, and it gained success in terms of success in translation, success in palatability and acceptance by respondents. We recruited 300 respondents across different places in Egypt, and we received several feedbacks from the respondents as well as the interviewer. And in addition, the Lebanese team were in parallel running their study, which is an aging study for Lebanese population as well, but was funded through the NIH. Now we are thinking that we have 2 parallel tracks, EMATCH, which should be a continuous network for aging in the East Mediterranean region. We have the very successful El Sahha in Lebanon. We have the promising Al Sahha in Egypt. So there will be no harm in collaboration, learning from each other. So Monique, who are the PI for the Lebanese study, visited the American University in Cairo and gained more knowledge about what we are doing. And also she briefed us about the achievements they have been doing. We are completing each other because Monique are doing great in the HCAP, which is the Harmonized Cognitive Assessment Protocols, translation and adaptation. And I guess we are doing great in the population study itself, reaching population and the core questionnaire. So next steps, after we finished our pilot, now we are planning for the population study. For that, we approached the Ministry of Health, and we had a dialogue, because currently the Egyptian government is starting a very ambitious project to tackle the diseases and health problems for aging population across Egypt. So it was timely. So they feel that it would be okay to, in addition to the regular or routine screenings they are doing, why not also to administer or approve the administration of survey through their different places across Egypt to cover the whole Egyptian country. That's what we are doing. We are also planning to apply for support from NIA. In addition to some local funding, we had several stakeholders dialogues with the WHO office in the Emro region, with the UNFPA and other stakeholders, invited the Minister of Social Solidarity. We had a dialogue with the technical office of the Minister of Health. So I guess we are doing great, and most probably, based on our pace, we will be able to launch the Al Sahha study mostly the beginning of next year, because currently the capacity to do this research, the availability of researchers and the potentials, I guess they are assuring or promising based on our pilot. In addition, in Lebanon, they are doing well. As I mentioned, we plan to have several conjoined capacity building activities to learn from them and also to try to engage with them to know the strengths and weakness in each study and try to continue working together. There is also some discussions in starting capacity building activities in other Arabic countries, like in Iraq, in Jordan, in Tunisia, alongside other East Mediterranean countries like Cyprus and Greece. So the dialogue is running, but at least Al-Sahha for Egypt is planned to be starting next year, the main study. And also now we are starting with the Arabic translation and validation steps for HCAP, because we plan to have the original or the core survey and the HCAP sub-study as part of the Egyptian aging study.
Wow, there's what's going on. Impressive, all that's happening. Maybe to circle back to the Ministry of Health a little bit, could you say a bit more about their current involvement, and also if so it sounds like they're funding it, and is also might they be using this to inform future policy, or how might they apply or use what is learned from the longitudinal study?
Okay, so the continuous discussion with the Ministry of Health led to their understanding of the value of such a study. So we had several, as I mentioned, we had several stakeholder meetings, we had several high-profile meetings. We seized that chance that they are already now targeting the aging population. This is, by the way, the main point addressed by the WHO EMRO office here and the UNFPA, but that they consider this decade, the decade of aging population, especially in the Mediterranean region, Middle Eastern region, because for years we considered ourselves a young population. Now the population pyramid is changing, so more of the community will be aging. So it is a time to study aging population. As I mentioned, Minister of Health started already some activities regarding screening aging or elderly above 45 years. Screening them for chronic disease and non-communicable disease. So this is a good step. Of course, this will provide access and database for millions of Egyptians above 45 years. So I guess our goals are aligned to their goals. So we are addressing different points, different topics, but in principle, we are all working together to understand the shape of aging population, the determinants of health and disease in aging population. That's why this time there were a strong appetite in the Ministry of Health, and they are now seemed very motivated to collaborate with us and work together with us. In addition, we had also our dialogue with the Ministry of Social Solidarity. They have their separate angle or different angles. They are looking at the low income places, health equity and inequity, and social inequity, but still it's a valid point to address those aspects during our study. So I mean, at the end of the day, all goals can merge together to achieve one goal, which is the understanding the aging scene in Egypt, and later on collaborate with other aging surveys in the region to launch a network in the Eastern Mediterranean and Middle Eastern region.
So that's very interesting. So the Ministry of Health you've been engaging with, but there's also another governmental...
Minister of Social Solidarity.
And did both of these, were there existing initiatives around aging already, or was it that you connected your study to, or how did that?
Yeah, exactly. That's a good point. I don't know if we are lucky but yeah, as a Ministry of Social Solidarity, they have their special initiative targeting those who are living in less advantageous places. So we will gain accessibility through collaboration with them. And the Ministry of Health are launching this wide-scale initiative to screen communicable disease across Egypt. So it's a good opportunity. So yeah, I guess we are seizing the chance based on those initiatives.
Yeah, absolutely.
Yeah, they were absent a couple of years ago, but since they have started, so why not to collaborate? I guess it's a good opportunity.
and for these opportunities, how did you first connect with these two different ministries? Did you just pick up the phone and call up the Minister of Health and they were excited to talk to Mohamed Salam? Or
no,
how did it happen that you began to engage?
First, the most important is I had this buy-in by my institution. So I moved since 2 years to a new place, which is the American University in Cairo, and they were establishing an Institute of Global Health and the Human Ecology. So the main concern of the new institute is to tackle global public health issues. That's why they start supporting me in terms of connecting me to different ministries, different governmental sectors, organizing different activities and meetings on different levels. So I remember in the early, just before the COVID-19, we had this AUC GBHI meeting in Cairo, and we invited Minister of Health, Minister of Higher Education, Ministry of Social Solidarity. Even if some of the ministers didn't attend, they sent some representatives. So we followed this track. So every few months we organize such an event and invite stakeholders, and the level of representation is getting high. So in addition, inside the institute, we start collaborating with different departments like Social Research Center. They have very good connections with the governmental sectors. So, for example, as I mentioned, the level of representation is going high until the last meeting was attended by or joined by the Minister of Social Solidarity, where she showed intention to support any of our initiatives and activities. Additionally, we could connect to other regional stakeholders like WHO, EMRO. They supported some of activities in like capacity building and training, and the UNFPA who mentioned that they can connect us to other stakeholders in the Arabic-speaking countries in the region. So I guess this is how it is escalating. First, support from our institution, trying to connect to different places, governmental sectors, and once they feel that you have something, you can recruit funding, for example, you can start some activities, you have solid connections, they will start to believe and take you seriously and start offering collaboration and support.
Very interesting. And so you started at one level, and then over time, as you were organizing these events, that more senior people would eventually come, and people are also having more success. For the initial contact, did the university that you were affiliated with reach out, or did you reach out directly to these ministries, or how did that happen? Initially, in the very early stages, I was trying to connect individually. So I am sending letters and emails, trying to visit, but the weight of connecting through the institution, especially the AUC has a very good reputation regarding similar studies and the community services. So connection through the institution was more rewarding, I would say. They take it more seriously when the invitation or the announcement is coming directly from the institution, from the counselor or whatever. So this is one of the lessons I learned. And you also mentioned that, so being connected with the university helps add weight, and also you mentioned previously about the importance of funding and others validating what you're doing. Is that right?
Yeah, exactly. Because the first question I was always asked, do you have money to start such an initiative or an activity at least? It's a good question. So having funding itself is a sort of credibility to your work, that to show that you are on the right path. And I would also mention having international collaboration. For example, when I visit or invite the governmental stakeholders, just mentioning that I'm Mohamed Salema, I would like to start this aging study, they don't have this buy-in, they don't believe that much. But when I say or tell them that I'm bringing with me SHARE, which is an aging study of the EU, I'm bringing colleagues from HCAP study at the US or whatever, they feel that, okay, they start to take me seriously. They feel that, okay, he has something to tell us. When I combine that to bringing money, I could recruit funding from Technical University of München. I could recruit funding from the German Academic Exchange Service, which is DAAD. They are prestigious and well-known organizations here. So they feel that, okay, this guy is talking seriously, and he has something. So let's listen to him. This is one important point. Maybe the initial funding is not that huge. We are talking about the image study. The goal is to have 300,000 euros. It's not that big funding that can cover the whole study. But as a nucleus or as an initial funding, it's a good thing, especially when you are converting into the Egyptian currency. So it can do something. At least we succeeded to do the pilot or the capacity building and recruit several research teams.
Very good. And have you engaged with governmental agencies, with ministries before, or was this a new experience for you?
Yeah, I had some engagement activities and experience, and still one of the things, for example, is currently I'm the scientific advisor for the Academy of Scientific Research and Technology regarding one project for aging population. So the Academy of Scientific Research and Technology in Egypt, it's the biggest science foundation in Egypt. And they are partnering with different European Union countries and similar foundation, try to advise a new social care model for the elderly. So they appointed me as their scientific advisor for this activity. This helped me also to know possible names, possible power or strategic connections in the academy, in the ministry. This could help, certainly. This has helped too.
Very good. And could you just quickly say a bit about what other stakeholders, you started to mention this a little bit, but other stakeholders that you may have engaged with or that were helpful as this is developed and getting more attention for this effort?
Well, as I mentioned, in addition, we have a network of governmental universities, and here in Egypt, the health care system is divided between the Ministry of Health, providing service through public hospitals, and the Ministry of Higher Education, represented by the university clinics in different places. So now we have a good network through this capacity building with different university clinics and different governmental universities. They can help as a focus point for clinical examination, collection of samples and data, and even administering part of the questionnaire through their places. And this is what happened during the pilot study. So we used 5 universities. We plan to expand on this network as well as a clinical visit places for those who will be recruited in the study. This is a very helpful sector in the stakeholders. Additionally, other NGOs and other working foundations, as I mentioned, like the WHO, they were very helpful, and they are promising to have some sort of support. UNFPA, they are providing us with outreach in the other Arabic-speaking countries in the region.
Great. And finally, any advice for current fellows that are thinking of maybe doing something similar to what you've done, or wondering how they might engage with decision makers and policymakers?
Yeah, one good advice is, first, don't think it will be easy. And first step is always difficult and hard. I remember the first time we had this meeting, Axel Zuban, he's the president of SHARE, coordinator of SHARE, and he was reminding me a few weeks ago when we had our first meeting. It was very disappointing. It was in 2019, and he reminded me that he said, "Okay, poor Mohammed, this is a crazy guy. It will not be done at all." Later on, you try to be persistent, knocking all doors, trying to gain credibility, and it will happen, but not from the first time. So this could be a piece of advice.
That's great advice. Thanks so much, Mohamed. Any other final comments before we close?
No, I'm fine. Thank you so much.
All right, thank you.